Hi, everybody. I'm Judy Klein, president of Unity Consortium, and welcome to Adolescent Immunization Action Week's panel of vaccine experts and advocates. AIAW is a week that we designated to collectively act to the benefit of the health of all of our adolescents and young adults. And immunization, as almost everybody knows, is one of the best ways to protect ourselves against serious illness. Sadly, during the pandemic, many adolescents fell behind on their well visits and immunizations and remain below pre-pandemic levels. At the same time, we all know that vaccine hesitancy among parents was increasing. And survey data really illustrates that with parents of adolescents. Right now, just 2/3 of them think healthy children should be required to be vaccinated to enter public schools, which is down from 3/4 back in 2019 pre-pandemic. Fewer than half of the parents of adolescents say that their teens have gotten the updated COVID-19 booster or are likely to do so. And 8.3 million adolescents have yet to receive even one dose of the COVID-19 vaccine. So clearly there is work to be done. And joining Dr. Clinton and I today are two highly engaged and innovating young adults, who I will introduce in a minute, who are advocates who act to benefit their peers and their friends, and a fantastic scientist, educator, and vaccine expert. We also want to hear from you. So write your questions and comments in the Q&A area. Now it is my absolute pleasure to introduce Dr. Paul Offit, attending physician and director of the Vaccine Education Center, both at Children's Hospital of Philadelphia, as well as a professor of pediatrics at the Perelman School of Medicine at the University of Pennsylvania. Arun Parsa, founder of Teens for Vaccines, member of Unity's Teen Advisory Council, and a 10th grader in California. And Lindsay Smith, leader of Vax Up Westchester, Teens for Vaccines, and a freshman at the University of Michigan. And I am thrilled to once again introduce our moderator, Dr. Chelsea Clinton, Vice Chair of the Clinton Foundation. And thank you, Dr. Clinton, for joining us for this very important discussion.
Oh, well, Judy, thank you so much for that warm welcome. I want to echo Judy's offer to please submit your questions for Dr. Offit and for our students. I'm really looking forward to this conversation today, and grateful to first chat with Paul and then to bring in our really dynamic student leaders who are on the front lines of trying to help educate and empower their friends and their classmates with the information that they need to make good choices for themselves as relates to vaccines and vaccinations. Paul, I wonder if we could, start with you just providing kind of more context to the challenging statistics that Judy shared around kind of the growing vaccine hesitancy among parents and the growing vaccine gap for adolescents and young adults. What do you think is really driving this, I guess, is the first question. And what messages and support do you think can help reverse those trends for both parents and adolescents?
Right. I think before this pandemic hit, I think in many ways the sort of anti-vaccine sentiment was on the run. I mean, you had state after state that was eliminating non-medical exemptions to vaccines, like philosophical exemptions or religious exemptions. There were 5 states that ultimately eliminated all of those exemptions, and because there was a societal sense that what you do and affects others. And then the pandemic hit, and if you'd asked me what would I have predicted, what would have happened, I think it would have only further marginalized the anti-vaccine movement because the vaccines were the ticket out of this pandemic. I mean, a pandemic that's killed more than 7 million people worldwide, a couple million people in this country, and you would assume that it would be something that was appreciated for what it is, which is a life-saving phenomenon. But I was wrong. I was dead wrong. I mean, what ended up happening is, and last year's an indicator of that. I mean, last year, there were 835 bills introduced into the legislature, many of which have been successful, asking the public health to back off, to not be able to mandate vaccines, not be able to mandate masks, and not be able to quarantine, not be able to isolate. I mean, in many ways, going into the next pandemic, and there'll be a next pandemic. There's been 3 pandemics and viruses in the last 20 years. We are going to be less prepared. And what scared me the most of what Judy said was that 1/3 of parents now say that they don't think vaccines should be mandated for schools. Get to that. Go to that, where you then don't mandate vaccines for school. And we're going to be where we were in the early 1970s, where measles was dominant in this country. And, let vaccine rates erode far enough, and you're going to see what you just saw in Rockland County, New York, where there was a case of polio in a 27-year-old man who never left this country. Don't kid yourself. I mean, there's no reason polio can't come back into this country. The virus that infected him will cause paralysis in 1 of every 2,000 people that's infected. That means he is the tip of a much bigger iceberg. And when they did wastewater samples in Rockland County, where he was, and surrounding counties, they found this virus. And the CDC is now looking across this country to see whether this virus is in wastewater. If you're vaccinated, you don't have to worry. But if you're not, as he wasn't, and he was living in a highly unvaccinated county, in Rockland County, you're at risk. So I do worry about this. I just think the anti-vaccine message going into this, and then I'll stop, was vaccines are unsafe. They cause diabetes, multiple sclerosis, hyperactivity disorders, autism, et cetera. But that message changed when this pandemic hit. It became solely a libertarian argument, right? Government off my back, don't tell me what to do. And that took. And so I think really with with sort of the COVID restrictions, we leaned into a libertarian left hook, and you're seeing the result of that.
Well, and certainly, Paul, the libertarian anti-vaccine messages had been trialed before, infamously in Texas and elsewhere in 2015 and 2016. But to your point, they hadn't really taken hold in the way that deeply worryingly they have over the last couple of years. I wonder, though, if we can shift to what you, though, have seen work to help sort of inoculate people in a social or arguably even kind of anthropological sense from kind of these libertarian or other kind of anti-vaccine messages, particularly young people, for kind of the focus of this week for adolescents, for young people. What have you seen to work to either help really edify the sense of, I need to do this because it is good for me and you. The science is robust. We have, decades or sometimes more of data that these are safe and effective vaccines. What have you really seen to work to either help prevent people from being susceptible to those anti-vaccine messages, or helping kind of unwind their power, so that young people and adolescents in particular are continuing to be vaccinated, not only for COVID, but also for all the other things that we know that young people should be protected against?
Right. The good news is the science is on our side. I mean, that the vaccines are safe and effective, that children can suffer and die from these vaccine preventable diseases. And I work at Children's Hospital of Philadelphia, and we see at least one child every year will come into our hospital who will suffer or be severely ill from a vaccine preventable disease because the parents had made that choice. Often what happens is, I would say most of the time what happens is they're then convinced. They've seen it, they realize this could happen to them, and so then they're convinced. It shouldn't have to come to that. So you'd like to think that we can use compassion and passion and education to sort of frame our argument in an emotional way, to make it clear that this is a risk that you're taking, and that there are no risk-free choices. I think people assume that when they don't get a vaccine, that's a risk-free choice. It's not. It's just a choice to take a different risk, and we have to make it clear what that different risk looks like, and do the best we can to make that different risk come alive without actually making it come alive. I mean, I was fortunate enough to know a man named Maurice Hilleman, I got to know him in the 6 months. Well, I knew him for 20 years, but knew him especially well in the 6 months before he died, because he allowed me to interview him weekly, and because I wanted to write a book about him. And in any case, so he's made 9 of the 14 vaccines we currently give to infants and young children. And I remember this was like 2004, 2005, around the time that he was given about 6 months to live, and lived 6 months. And I remember, so here's a guy who made 9 of the 14 vaccines we give to infants and young children. I mean, this was his life, trying to prevent prevent the diseases that cause children to suffer and be hospitalized and die. And this was right around the time of that measles immunization rates were starting to erode. And you started to see measles outbreaks, for example, like in Southern California. And I said to him, is there any way we can convince people not to suffer these diseases without actually having these diseases come back? And he sort of turned his back to me, looked outside on this wintry day in suburban Philadelphia, and thought for a long time before he turned around and he said, no, I think that's what it's going to take. I think people are going to need to see these diseases again, which was a tremendous defeat for him. I hope he's not right, but that's how he saw it.
Just how tragic to think, Paul, that you will have to have probably not one, candidly, but many children, many young people get sick, possibly die, suffer lifelong disability because we are moving away from kind of what we have known has overwhelmingly been safe, although not without risk, but overwhelmingly safe and overwhelmingly effective to help protect people against measles, against mumps, against rubella, against pneumonia, against hepatitis, against HPV, all these things that we know, can cause such enormous harm. And I too wish that we didn't have to see that harm, manifested in the real lives of real children and real adolescents, to try to persuade the public of what we never should have lost hold of. I mean, it is a really
there's so much we don't know in medicine. There's so much we can't do. I mean, there's a lot of frustration in the hospital with diseases that we don't really know how to handle. We do things, but they don't really work, depending on, sort of things like disseminated pancreatic cancer, or disseminated metastatic melanoma. I mean, these are death sentences, and there's not much you can do. We do things, but there's really not much you can do. This we know. Vaccines can prevent certain diseases. And in 2020, when SARS entered this country in January of 2020, our hospital was flooded with COVID cases. I mean, we had 3 floors of COVID cases. We stopped doing elective surgery. It was all hands on deck. And you're just seeing children come into the hospital, struggling to breathe, being put on face mask oxygen, being brought up to the intensive care unit, being put onto ventilators while their parents are crying, watching their children suffer so badly. That was hard enough. But the following year, 2021, at the end of which we had vaccines for children down to 5 years of age, and you watch the same events playing over and over again because their child wasn't vaccinated and they weren't vaccinated. Nobody in the family was vaccinated. That was especially hard because this was all preventable, and it's hard to watch.
Well, Paul, before we bring in our 2 young leaders, I want to just give you the chance to please answer a couple of the questions that have been submitted for you. The first comes from Rachel, who asks, before the pandemic, was there another vaccine that was on the radar of parents specifically as a potential, threat in their opinion or concern, or was it kind of vaccines broadly? She wants to know what you think about that.
I'm not sure I understand the question exactly. Does she mean
I think she's asking, was there one vaccine, let's say the MMR vaccine, that was receiving a lot of anti-vaccine efforts and attention and organization and funding? Because also, as a parenthetical, we know that the anti-vaccine movement is not an organic one in many ways. It is a kind of carefully constructed and financed one for its own purposes. And so I think Rachel is curious, was there one vaccine that had really animated concern, or was there growing hesitancy broadly?
So I would say the birth of the modern anti-vaccine movement was in the early 80s, with the concern that the pertussis or whooping cough vaccine could cause permanent brain damage. Now, that was wrong, but that got a lot of play. And really energized the anti-vaccine movement for 20 years until the next one hit, which was late 90s, with this false concern that the measles, mumps, rubella vaccine could cause autism. And I think that became the focus for a long time, the measles containing vaccine. And the thing about measles is it's the canary in the coal mine. You can tell when vaccine rates are starting to erode from measles, because it's the most contagious of the vaccine preventable diseases. So when there's an erosion in rates, and there is an erosion of rates, as Judy pointed out, that's the first disease you see coming back. So we had a big outbreak in 2015. And you saw, for example, in New York, in the ultra-Orthodox Jewish community, there were a number of children that were hospitalized and put on ventilators in the intensive care unit at NYU because their parents had chosen not to vaccinate them. So I would say that's the one that was probably the biggest target because of this false notion that it caused autism. It's just been hard. It's hard to watch how, I mean, I'm an old person, as you can see, because you can see me visually, but, so I grew up, I was a child in the 50s and 60s, and you had a much harder time getting bad information out there. Not true today. I think social media allows bad information to flourish much more readily.
So arguably Andrew Wakefield did a lot of harm before the arrival of social media too. So the next question, and then we'll bring in our terrific young leaders, is from Eleanor, who says she works in a high school, and many of the students who are lacking vaccines are what she calls newcomers, students who are new to this country, and they don't have vaccination records with them. And many of them, may not want to get vaccinated, even though they have a clinic in their school that is able to give all vaccines except the varicella vaccine. Do you have any suggestions for Eleanor or for other teachers and administrators that may be in a similar position with lots of kind of new immigrants, refugees, young people seeking asylum who are thankfully in our schools, but have not yet been fully vaccinated?
Right. So in a better world, hopefully when they come into this country, that they would have a record, if there is such a record, of what vaccines they have or haven't gotten, which would then help the physician figure out how to move forward. Most vaccines given in other parts of this world are fine, but it would be nice to know which ones they've gotten. Assuming you don't have that record, and you don't know, and they might not know, then you would like to be able to convince them that even though they're here, and we have a lesser rate of many of those infectious diseases as compared to the developing world, that these viruses still circulate in these countries and cause harm, or bacteria. I mean, measles is still out there, mumps is still out there. We eliminated rubella by 2005, but it's certainly in the world and could come back here. I mean, polio is still out there in certain countries. So we're always at risk. International travel is common. Everybody's at risk. And although, as you said earlier, I mean, no vaccine, no medical product is absolutely safe. Anything that has a positive effect will have a negative effect. In fact, if it doesn't have a negative effect, it probably never had a positive effect. Look, the question is, do the benefits clearly outweigh the risks? And that is true for all vaccines. I mean, I think I'm educated about vaccines. My two children are fully vaccinated. I have a new grandchild, which I would show you a picture of actually, but because I just did before you got on, Chelsea. But so she'll be fully vaccinated. So I think that to understand vaccines and to understand their risks and benefits is to get them. I think those who choose not to get them are just being misinformed, and it shows you the power of misinformation and disinformation.
Yes, well, all of my children are certainly also vaccinated, and are very proud of their, Crayola crayon or superhero Band-Aids that they get, because they know that it signifies that they're going to be able to go to school for the crayon, or, maybe help them grow up to develop or discover their own superpowers. We do already have more questions in the chat, but I want to bring in our terrific young leaders to give them the chance to also answer some of these questions. So hopefully Aaron and Lindsay can come off mute and join us now, because I think really the next question should be kind of first given to the two of you to kind of provide your perspective on, and then hopefully Paul to weigh in as well. And so a question from Matthew says, from my own personal observation, the people pervasively spreading anti-vaccine messaging are strongly correlated with an anti-science background. It seems the best inoculation against susceptibility to vaccine misinformation is a stronger critical thinking and science curriculum in youth and for young people. I would ask both of you, do you agree with that? And if so, what type of education have you seen either in a classroom or education that you've both been engaged in your own advocacy work that really helps to answer Matthew's question? Lindsay, maybe we start with you, and then Aaron, hopefully we can hear from you.
Yeah, so last semester here at the University of Michigan, I took a class called Public Health 200, which is like an intro public health class. And we kind of went from the beginning of the 1900s to current times now. And we did learn a lot about the different vaccines, the different benefits, different pandemics we've had, and different issues we've had in the United States. And I think this is definitely a good basis for learning more about how vaccines work, their benefits, and possible side effects. But I think while this class was like completely optional, I signed up for it. Many students who maybe my age would not sign up for the same class if they already had the spacer that they don't believe in vaccines. Maybe there could be options for high schoolers when they're starting to get to that age when they can have the conversations with their parents. So having an added unit into one of their science classes could definitely be helpful. But I think as a teen, a lot of people will stay to what their parents believe. And even if they're learning the basis of the science in class, they might not still be willing to have these conversations with their parents and may still have the same opinions that they've been taught.
And Erin, what do you think, particularly from a high school perspective?
So from a high school perspective, I think I deeply agree with Matthew. I do think that the best way to fight susceptibility to vaccine misinformation is stronger critical thinking and science curriculum. And I started teaching vaccines back in 2019, and I noticed a lot of the same issues that Matthew's picking up on back then, where a lot of teens weren't really interested in joining teens vaccine because vaccines weren't a common topic back then. A lot of people weren't talking about the issue related to public health. Around that time, there were some other pressing issues that needed to be addressed. But with COVID now, the hope is that vaccines are now a mainstream discussion, they're a mainstream topic. And because of that, I think that now we can really look forward and try to incorporate vaccines more into more of a conversation and discussion rather than before the pandemic when it was not really discussed at all. So I do agree with Matthew, and specifically what I think could happen is that I think we need to reform our national science standards in our public schools to make sure that all students learn basic vaccine science, so how vaccines work, and the different concepts related to vaccines, such as herd immunity and other public health topics, to make sure that ideas such as 5G influencing COVID back in 2020, another idea about how magnets are in the vaccines, like all those ideas were popular because people didn't know how vaccines worked. So I think if we start younger and help allow young people to get to learn about vaccines, we can really prevent all this misinformation. So I think it's best to start at the source.
Paul, do you have any thoughts to add?
I think that's really the central issue. I mean, it's to make medical decisions, including a decision about a vaccine, is really an exercise in critical thinking. I mean, what do you know? Do you know enough to be able to get this vaccine? Because I was on the advisory committee for immunization practices when the human papillomavirus or HPV vaccine came out. So what did you know? You know, it had been given to 30,000 people. You knew that HPV causes tens of thousands of cases of cervical as well as head and neck and anal and genital cancers every year. You knew that this vaccine induced high levels of antibodies, which would be neutralizing. You had all that information. But some people would argue, yeah, but we haven't studied it for 30 years. So do you want to wait 30 years so that every year another 25 to 30,000 people are going to get cancer from this vaccine, get cancer from this virus? And that's what it is. Well, I mean, I'm on the FDA's vaccine advisory committee now. We sat down in December of 2020 to make a decision about, are we going to recommend authorization of these 2 mRNA vaccines? Remember, we've never had an mRNA vaccine before. This was a novel technology. Did we know enough? Because you never know everything. The question is, when do you know enough? So it's an exercise of what do you know and what don't you know, and does what you know overwhelm the stuff that you don't know? And it is that, and we're not taught that. I think we're not taught that. We're taught more pattern recognition than we are sort of critical, hierarchical, logical thinking.
Well, and I think also, in the Q&A from our audience, there's a real emphasis too on helping to ensure that providers know how to have these conversations, Paul, that we also are educating our doctors, our nurses, our school nurses, our social workers, the places where parents and maybe, adolescents and even kids themselves may be going directly for advice and guidance. And really, I think bluntly, we need to do a better job of educating, our providers broadly to also be equipped to have these conversations from a place of critical thinking and also kindness and compassion and community. And so wonder, Paul, kind of what you think about that and what you think kind of we should be, asking and then expecting out of, institutions, like yours and many others, given kind of the strong thread that I certainly agree with, that I see in the chat of people saying, how thankful they are that their providers are really open to having these conversations, how thankful they are when there is a real kind of empowering of school nurses to have these conversations, how important kind of kindness and active listening are, as well as critical thinking and good communication skills. So just, curious, Paul, given all of the different hats that you wear, kind of what you think about that.
I think when parents come to me, or my wife is in general practice pediatrics, it's fine to ask the question. I mean, my child was fine, they got this vaccine, or my friend's child was fine, they got a vaccine, and now they have this problem. Could the vaccine have caused that problem? All those questions are reasonable to ask. So how do you answer them? How do you go about answering that question? I think as clinicians or providers, we need to be able to explain how you answer those questions and how, in a particular case, the question has been answered. I mean, when Andrew Wakefield, for example, stepped forward on February 28th, 1998, so almost exactly 25 years ago, and said, the MMR vaccine caused autism. All he had was 8 children who had recently received the vaccine and then got autism, which taught you only that the MMR vaccine doesn't prevent autism. You may get the vaccine and still end up having autism. It only prevents measles, mumps, and rubella infection. So he didn't do a study. There was no study there. So how would you do that study? You would look at children who did or didn't get that vaccine. You would make sure that that variable was the only variable. In other words, that those two groups were alike in all other aspects: medical background, healthcare seeking behavior, socioeconomic background. So you could isolate the effect of getting the MMR vaccine or not. So that study has been done 18 times on 7 different countries, on 3 different continents, costing tens of millions of dollars. Answered. That question has been answered. You're at no greater risk of getting the autism if you got the vaccine or not. And I think what happens then is you cross the line. Most people are convinced by that. I mean, if you look at when, for example, Andrew Wakefield raised that question 25 years ago, 90% of parents of children with autism thought their vaccine could have done it. Now it's more like 15%. So it's much, much less. So we did answer the question, and most people are convinced by that answer. I think when people aren't convinced by that kind of answer, which at this point is not a question anymore, then you sort of cross the line from, I think, healthy skepticism to cynicism, that you think there's just a conspiracy to hide the truth, and it's very hard to convince people away from that.
I think that, as you see from all of the thumbs up, there's lots of agreement and resonance with that. I think also I want to now turn to the HPV vaccine in particular, because we have quite a few questions and comments on the HPV vaccine. And so, I'm just going to bundle them together with hopefully the forbearance of the individuals who asked them. A question around, why do parents continue to think the HPV vaccine is only for females, or for adolescent girls? Kind of what can we do to better educate parents on that? Question of kind of what really should we be communicating effectively more broadly to parents, and also to adolescents. And I wonder, and if maybe Erin, since you were nodding, and Lindsay, if we could start with kind of the young people, are your friends asking you questions about the HPV vaccine specifically? What are you telling them about kind of why it is so important that they do get vaccinated against the HPV vaccine? Have you encountered any specific HPV hesitancy, either broadly or kind of around boys or young men? Just any of those questions that you'd like to engage in, would certainly welcome your thoughts. And then Paul, after we've heard from Erin and Lindsay, you hope to hear yours as well. Erin, why don't you go first, just because you were nodding so much?
Right. So for the HPV vaccine, I think the reason why young boys should get the vaccine is because HPV prevents against 6 different kinds of cancer. There's a stigma around HPV where girls are seen more promiscuous, so they want to get it, but boys should get it because it prevents 6 different kinds of cancer. And I think we all don't want to get cancer, so it's a pretty logical choice to get the vaccine. Also, in terms of seeing specific HPV vaccine hesitancy around young men, I've definitely seen that. I've been on social media sites such as like Reddit and Twitter, where I've heard stories of parents not getting the HPV vaccine for their children because they're boys, so that they don't see it as important, when in reality it is as important, if not a little more important for boys that young to get their HPV vaccine. because it's so important around that age to be up to date with all your vaccines. So, and I think the way to combat this is to remove the stigma surrounding HPV for young men because it, as I mentioned earlier, it prevents 6 different kinds of cancer. So if we can put aside societal stigmas, if we can put aside everything else, all our notions about HPV, and focus on, once again, as Dr. Offit mentioned, critical thinking about the vaccine, it does nothing but good for young men, for young girls, for everyone really. So I think there's only one right answer for why we should get the vaccine. It's because it is so effective in treating or, well, preventing different kinds of cancers that it really makes sense that we must all get it.
And Lindsay?
Yeah, I remember when I first got my first dose of the HPV vaccine, I was with my brother. We were both getting our yearly checkup, and he's 2 years older than me, but we both got it at the same time. And my dad was there, and it was there was no conversation. It was kind of just like giving the information about why both of you need the vaccine and not just me. And a few years later, it became very prevalent in my own life because my uncle was diagnosed with cancer from HPV. And so I think that it's really important. Back then, when I first got my first dose, I had no idea kind of why I was getting it. I was just like, oh, my parents are saying I'm getting it, and my doctor said I'm getting it. So starting when we're younger, around those ages, directly focusing initiatives on social media and conversations with our friends when we're getting to that age of when it's recommended, to have those conversations and explain why it's necessary for both boys and girls, and why it is so important. And if a parent is kind of hesitant, having those healthcare professionals be versed on how to have the conversation with that parent, how to have a one-on-one conversation with the patient about how to continue having those options and conversations about why it's so important, so we can kind of reduce that stigma against only girls getting it, and just in general making sure parents and individuals are more versed on why it's so important.
Thank you, Paul. And particularly, someone asked about kind of the in rural Iowa, the state is pushing kind of the suggestion of starting as early as 9 years old for the HPV vaccine, and just want to ensure that you also can maybe hopefully respond specifically to that point, as well as to the kind of broader points that Aaron and Lindsay so helpfully made.
Right. So, yeah, there's no reason not to start earlier. In fact, you could argue that you could get the HPV vaccine in the first few years of life. I mean, the technology that's used to make that vaccine, which is this recombinant DNA technology, the same technology that's used to make hepatitis B vaccine, which you also get in the first sort of few years of life, has shown that, it induce essentially lifetime immunity, because all you need is immunological memory, and both those vaccines do that. I mean, I was on the advisory committee for immunization practice right around the time this vaccine was coming up, because it was I think licensed in June of 2006, so it's 17 years old at this point. But this is, at the time, 29,000 cases of cancer every year, 2/3 of which occur in women, 1/3 of which occur in men. Although one thing that's interesting is that, like hepatitis B, which is a virus that can cause liver cancer, although these vaccines are given in childhood and therefore recommended and given by pediatricians, the pediatricians don't see the consequences of those diseases. So the pediatricians aren't usually the ones that take care of HPV-associated cancers or hepatitis B-associated cancers. And sometimes for that reason, they're somewhat less likely to be advocates than say an oncologist would, who does take care of those patients. And I think they're not as good in some ways at being as dramatic as you could be about what those cancers look like, because generally they don't take care of those cancers. But they are, it's, again, this is a preventable cancer. The hepatitis B vaccine was the first vaccine to prevent a kind of cancer. Human papillomavirus was the second. So it's really important to get it. In terms of 9 versus getting it sort of a little older, I don't think it really matters. I think in both cases, it's an excellent vaccine. And now you have, 9 serotypes. It's gone from the 4 serotypes to the 9 serotypes. So it's even more broadly protective.
And I also just want to acknowledge, thankfully, all of the people who are putting kind of very specific resources in the chat, actually sharing their contact information in the chat for anyone who wants to further engage kind of with them in their work to increase vaccination rates. I am really mindful of our time and want to continue to get to the Q&A that have been, or the questions that have been submitted in the Q&A. There, I think, is a really important question from a young person who's asking about how she should approach their 11-year-old sister about her vaccine hesitancy, the sister's vaccine hesitancy. Her exemption just got revoked, and the required vaccines are causing resentment in the household. What advice, Lindsay, Aaron, Paul, would you have kind of for intra-family conversations? So now kind of moving out of the school setting, moving out of kind of the pediatrician setting, and really kind of within a home. Have any of you had challenging conversations with your kind of family or closest friends that you would feel comfortable sharing to really help the person who asked the question, help their sister hopefully understand why getting and remaining vaccinated is so important?
So for Teens for Vaccines, we've worked a lot with on Reddit and other individuals who have kind of shared their story anonymously about asking for advice about how to approach these conversations. And while they are extremely difficult, one of the most important things I would say is, as for an 11-year-old, kind of finding it easy to understand graphics or kind of like comics or videos that could simply explain the vaccine, the limited possible side effects, why it's so important, so that she understands this from like a more simple perspective instead of kind of like, I know so many people hear about all these crazy stats and everything, and so just giving her the basics about why it's so important, why she should get it, and having these kind of conversations in a general way instead of having them be like nicer and more understanding, instead of being like more accusatory and being not so friendly about it. It's being just like having a general conversation that she'll completely understand as a younger individual.
Aaron, do you have any thoughts to share?
So I really agree with what Lindsay said. And I think another important part of having these discussions is that, as I mentioned, they are very tough. So the first thing you want to do is get your facts straight coming into your conversation with your parents to make sure that you can address all their potential thoughts and all their doubts about the vaccine. Another important part of these discussions is finding a good place to talk, because often parents are stressed, they have different things to worry about in their life. So finding a good time to talk when they're relaxed would prevent conflict and make the conversation, I think, easier. And then if that doesn't work, then I believe that it also makes sense to get other trusted advisors in, such as school nurses, teachers, doctors, other family members, etc., to bridge the conversation. And on our website, actually, we actually have a guide for these teens to see how to talk to their parents. I'm not sure if I can put it in the chat, but I'll do that right after I finish talking. But yeah, so I think that's a really important aspect of having these difficult conversations. I never personally experienced this with my family. I've been very fortunate to have supportive parents. But I have had friends who are doubtful of the vaccine, who subscribe to some of the misinformation about the government hiding things, about the vaccine being rushed, etc. So I tried to have that conversation with her, and thankfully it did end up working, where I was able to address most of her comments and her feedback. So yeah, these tactics are proven to work. I've seen it on Reddit, social media, and in my own experiences. So while these conversations are tough, they can definitely be fruitful and can lead to some actual agreement on these issues.
Great, thank you, Aaron. Paul?
I think we ask a lot of parents and adolescents and children in this country. We ask them to get, in the first few years of life, vaccines to prevent, now if you count COVID, 15 different diseases. We ask them to get another 3 different vaccines in adolescence. I mean, that can mean as many as 27 inoculations in those first few years of life. It can mean as many as 5 inoculations at one time to prevent diseases most people don't see, using biological fluids most people don't understand. I think it's perfectly reasonable and understandable how people can recoil from that. I mean, you know, my children are fully vaccinated, but when my son got laid down on that crinkly white table at 2 and 4 and 6 months of age and got several shots at once, you still recoil from that, even though I would argue, you know, I have some understanding of what's going on. It's still the image is dramatic and difficult. And so the fearing the vaccine is completely understandable. And for some people, they're really scared. And I think you have to recognize that and do your best to sort of talk them down off the ledge as much as you can. Within families, it's even harder just because, you know, there's all the emotions associated with families. For me, it was my sister-in-law. Hopefully she's not watching this, but it was my sister-in-law that was trying to sort of calm her down from these things. But there's always an overlay of, you know, the sort of the family angst to this. I mean, it's hard enough as it is, but it is understandable. I think one thing that helps is realizing people really are scared. So in theory, the best way to moderate that fear is to prevent facts, information in a compelling and passionate and compassionate way.
Paul, I think that's a good segue to a question we got from Worcester, Massachusetts, from Brandon, who has shared that they really focused on kind of building a network of trusted messengers to disseminate reliable health information. And Brandon's asking, what advice do you have about how best to use that network, that ecosystem of trusted messengers to combat misinformation around vaccines and other public health issues? So, you know, Paul, maybe since it is a segue from what you were just sharing, we can start with you and then hear from Aaron and Lindsay.
Sure. So for example, the anti-vaccine activists a number of years ago targeted a Somali American community in Minnesota and gave them all this false information that caused immunization rates drop from the low 90% to the low 40% range. And there were measles outbreaks. And so what the question was, who do these people trust? And the feeling is that the religious leaders were whom they trusted. So groups tried to sit down with religious leaders, educate them about, you know, what vaccines can and can't do. And with that, they've been slowly able to get immunization rates up again for that reason, that this was a group that people trusted. The same thing's true actually in suburban. There's an ultra-Orthodox community where I was asked to speak, but it was really the religious leaders in that community who had the most influence. So talking to them probably made the biggest difference. But that's the issue. Who do people trust? Who's the trustworthy messenger?
You know, Lindsay or Aaron, any thoughts to share? Lindsay?
Yeah, I definitely agree with that. Through my work with Vax Up Westchester in the past, we did videos with one of the very prominent priests in the area who gave kind of an endorsement about getting the vaccine, the COVID vaccine specifically, and why it was so important. So having these, talking to like the leaders in the community and having them create short videos or short infographics where these can be publicized is definitely really important to get more people to trust them, because as an individual just coming into a community you're not a part of, it could be definitely difficult to convince other people.
Aaron, anything you'd like to add?
I think that I completely agree with what Lindsay and Dr. Offit said. I think what I'd add to that is that for TFV, we're a national organization, so we've encountered a lot of different areas of the country, from California down to Texas to Florida, etc. So, and in these different communities and areas, you're going to have different vaccine culture. You're going to have different customs, etc. So, trying to bridge a cultural gap, I think, is almost as important, if not a little more important, than trying to have a conversation, because, you know, a person from California versus a person from Texas, there's a lot of differences there, a lot of stereotypes, and a lot of barriers. So in bridging these conversations, I think we need to see each other more as Americans, but also people at the end of the day, rather than just defined by where we are. So that these barriers, these differences are very critical for breaking down conversations.
Well, Aaron, I couldn't agree more that we all need to continue to kind of learn with and from one another, and want to really thank everyone who has put so many resources in the chat, many around the HPV vaccine specifically, and what different states and communities are doing to increase the rates of HPV vaccinations. And so I would urge everyone, please, to look at the resources, to kind of reach out to people who've offered to kind of welcome your questions or your thoughts. and certainly to continue to reach out to our amazing panelists to see kind of what more you can be doing to support their work, to learn from their work, to have kind of their work hopefully kind of strengthen your own. And so want to though give our panelists kind of a closing word before we hand it back to Judy. And so would just ask each of you, maybe Aaron, we start with you, Lindsay, and then Paul, what else do you want our audience to know? What do you think it is important for healthcare providers, for parents, for educators, teens to know about kind of what we've talked about, or what haven't we talked about that you want them to be mindful of and to be thinking about after our time together here today? So maybe Aaron, we start with you, and then we'll go to Lindsay and then to Paul.
So I think something that all teens and parents should take away is that teens want to be heard and be involved in decision making. So I think what we really want to see is teens having more one-on-one conversations with doctors during visits, as well as public health educators during joint family events. And also that we touched on this earlier, but public health curriculum in schools does not always include vaccine doses and schedules. So despite having STI prevention as part of the curriculum, the HPV vaccine is not talked about as much as a preventative measure for cancer when it is extremely important. So we would really want schools and science teachers to empower teens with knowledge about vaccines. And also another aspect in this panel that I don't think we've fully addressed is the fact that a lot of teens don't have easy access to vaccines, where in rural areas where teens are often isolated or have parents who are busy and have difficult schedules, school-based health centers and mobile clinics are probably their easiest way to go get a vaccine instead of going to a doctor's office. Having more school-based health centers, school nurses, as well as mobile clinics, I think will really help. But ultimately, I think if students and teens aren't aware of their schedules or don't have easy access, they can't initiate the conversation to get a vaccine in a timely manner. So overall, I just think that we need teens to involve more in discussion about vaccines, help teens get vaccines, and most importantly, just reframe the conversation about vaccines to include teens more.
Couldn't agree more. Lindsay?
I completely agree with everything Arn just said, but I think it is so important to bridge the gap between teens, parents, and healthcare workers, and increasing the conversation so that when teens are at these their well visits or their vaccine appointments, they're truly understanding on why they're getting their vaccines, what vaccines they're getting, what those benefits are, so they can have these conversations with their parents. They can have the conversations with their friends who may be having different conversations with their parents. So having kind of increased conversation amongst teens, parents, and healthcare workers about why vaccines are so important and what they should be doing to get the message out.
Great. Paul?
Thank you. Yeah, this event has educated me that I should spend more time around young people. I mean, this is really encouraging. I love hearing that this gives me hope for the future. See, I just hang out with like older people. As you get older, you get grim. So this is good. This is really hopeful and really great to hear. But I think that's right. I mean, adolescents are advocates for a great many things for themselves, and there's no reason healthcare shouldn't be part of it. I think as an adolescent, certainly, I remember as myself as an adolescent, you sort of think you're invulnerable, that bad things are never going to happen to you, but they can happen to you, and they do happen to people, and it might be you. So you need to be an advocate for your health, and that's what vaccines are. They're preventive. I think where vaccine sufferers, in many ways, they're a victim of their own success. We don't see a lot of these diseases anymore, and so we assume they're all gone when they're not.
Yes, and we don't want to give them an excuse or doorway to come back. Paul, thank you so much. I think speaking for kind of hopefully everyone here, we also would like to hang out with you more. So please come back and join us for future events. And again, I just really want to thank everyone who's been here and everyone who continues to share so generously kind of their experience, their expertise, their work, kind of their offers of partnership in the Q&A. And also I'm always so thankful to be with Unity and want to hand the proverbial floor and the actual Zoom back to Judy.
Thank you so much. And I'll just add to thank you for each of you for how well-informed, how expert, and how passionate you are. So you are that credible voice that is out there. So it's not only that you know this stuff, but you are giving of your time and yourselves to help spread, these positive and supportive messages that Lindsay and Aaron and both Paul and Chelsea said are so important to be out there. So thank you for all you do. Thank you for being part of Adolescent Immunization Action Week, and thanks for your continued support. Everybody have a wonderful week, day, and holidays.